So we're gonna go over the exercises to do when you're 0 to 2 weeks right after having rotator cuff surgery. So the first exercise is gonna be important to do, taking your arm out of that sling, giving that arm some time to relax. You're gonna take your surgical arm, these are called pendulums. You're gonna use your hips to kind of shift your weight around, and you're just letting that arm kind of hang around in the socket, and you should almost get to where you're kind of having like a counter force width from your hips to your arm. So again, you're just gonna go clockwise, counterclockwise in each direction. The next one is going to be where you are just gently squeezing either a towel roll or a squishy ball. This is just to help with any kind of swelling potentially that could develop in that hand, and also just making sure that you're using that hand and the dexterity in that hand maintains. All right, next is going to be some scapular squeezes, some shoulder blade squeezes. So you're gonna think about bringing your shoulder blades down and back, squeezing those shoulder blades together, hold a couple seconds, and then relax. Okay, and then the last one is going to be just a neck stretch. A lot of times your neck can get really tight from being held up and supporting that arm in the sling. Usually a good stretch is going to be where you're bringing your chin down to the opposite corner, placing your hand on the back of your head, and then gently pulling down. Hold that for about 30 seconds and relax. And another one is where you're bringing your ear to your shoulder as well, gently pulling, holding that for 30 seconds, and then relax. And just as a general statement for these next exercises that I am showing, you want to make sure that you're either checking with your doctor or with your PT, because some of these exercises might go against your protocol depending on the type of surgery that you had. And to do a bicep curl, you're going to grab a TheraBand, step on it with your foot, and then bring that arm up to your shoulder. All right, and then next is tricep, so you can hold that with your other hand, similar in nature, starting up a little tall, up higher towards your hand, and then pulling down like this. Another one can be where you're going to do just some generalized movement of that shoulder. You can use our little setup here like this, using some bands. And what you're gonna do is you're gonna gently use your other arm to help assist your arm up overhead. Just working on that generalized mobility, pulling as hard as you can, letting it relax. And then a slightly different motion up and out to the side. Okay, again, this is just gonna be dependent on what your protocol is. But the arm, your surgical arm, should be relatively weightless for this. The next one is going to be for your isometrics. So you're going to take a towel roll here. You can open up the door. You're going to work on your strengthening in a couple different patterns. First one is going to be where you take your hand, your fist towards the wall, and you're gently just pushing into the wall like this. Hold for a couple seconds, and then relax. Okay. Next one is by the side, pushing your hand into that direction, keeping your elbow in. Again, push for a couple seconds, relax. Take that, place it now by your elbow, and you're essentially pushing your elbow into the wall. Hold that for a couple seconds and relax. You're gonna turn around. Elbow is now against the wall. You're pushing back. Hold for a couple seconds, relax. Another one you can do, elbow in by your side, or excuse me, rising by your side, squeezing here, and hold for a couple seconds, relax. And last one, towel roll here, hand, and then you're pushing your hand into that towel roll.